Hi there, I'm Audrey Adams, and this is Talk with Audrey. Welcome back. Medicare open enrollment has already started. It runs now through December 7th, and it's a time when seniors have the opportunity to review and make some important changes to their Medicare plans. According to the Pew Research Center, approximately 10,000 baby boomers are going to turn 65 every single day for the next 15 years. And it's never been a more important time for seniors to know and understand their health care benefits. Joining me is Dr. Dedra Marshal from Healthcare Partners. It's a DaVita Medical Group. Welcome to the show.
Thank you so much for having me, Audrey. Good morning, and thank you for covering this important topic.
So, Medicare open enrollment, what's it all about?
So Medicare open enrollment is that key time that spans for 7 weeks where it's really important for our senior patients to be evaluating their unique health needs and making sure that they're choosing a plan that best meets their unique needs. As our seniors change, as their health needs change, it's always important to evaluate, is the plan that you're in still the right one for you, or should we be considering something different?
And when you're considering something different, what aspects of your plan should you look at specifically?
So the most important questions that I have patients be sure to ask are those related to the things that are most important to their health. For example, I generally recommend the 4 C's because it's easy to remember. So I tell patients to look into cost. What are the unique costs associated with a particular plan? For example, the co-payments for your office visits and your deductibles and premiums. The second C stands for care. So I generally have patients take an assessment. If you love your doctors and you wish to continue care with them, be sure that they're also covered under your plan. And then the third C stands for coverage. Many seniors are on prescription medications that we really need to make sure are covered under their existing plans. And then the fourth is convenience. So we want to make sure, especially us here at Healthcare Partners, which is a DaVita Medical Group, that you have access to the most convenient and coordinated care possible.
It's cost, care, coverage, and convenience.
That's correct. And use your doctor as a resource. And so, again, that doctor visit really allows you to sit down and look at your unique health needs and how they may change even in the coming year, and to really determine if the plan you're in is the best one, and if some changes need to be made, this is the time to make those changes.
And what about changes and reforms? Is there anything that we need to know about that?
So we actually haven't seen that there are going to be any major changes for 2017, but even absent changes, we always recommend that you really do that assessment of your current health and your current plan with your physician and with a Medicare specialist, because even your health care can change some, and we would want to make sure that you're still in the right plan, even if there are no major changes to that Medicare plan.
Are there any questions that seniors need to ask to ensure that they're choosing the best option?
So seniors should be asking questions associated with their particular and unique medical needs. They should be asking the questions that start with C, the 4 questions about cost, care, coverage, and convenience. And as they go through these questions and really look with their doctors at their own unique healthcare needs, these questions are going to help them to decide if they're in the best plan, or if they should during this time be choosing a different plan that meets their healthcare needs. Let's face it, this time really is for us to place the importance on the patient's health, and that's the most important purpose of this time, is really to make sure that we're giving the best care to our patients and that we're able to do so in a plan that best meets their needs.
Absolutely, makes sense. Give us, if you would please, those websites again.
Yes, so to get information about this Medicare open enrollment time and answers to some of your questions, Medicare offers a website, medicare.gov, and Healthcare Partners, a DaVita Medical Group, also offers a great website, www.hcpopenenrollment.com.
All right, Dr. Dedra Marshal is my guest. Thanks so much for joining me on the show. And guys, remember, informed is empowered. And even if you're not in that 1 in 10,000 right now, you will be someday. And it always helps to be prepared, so check it out.
Thank you so much.
Up next, a non-treatment based innovation to support cancer care for patients and caregivers on a day-to-day basis.